Well, let's talk about what everybody's talking about. The wow makeover of Kris Jenner. Hi, I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and let's take a deep dive into the matriarch makeover, Kris Jenner and her new face. So it should be titled, Smas or deep plane. Who knows? So let's take a look at the unmasking of this amazing transformation. So Kris Jenner, as you know, is the matriarch of the Kardashians. She's a businesswoman, the CEO of Jenner Communications. She's really the mom manager of the Kardashian Jenner family, who manages their business empire and their children's careers. And she's been credited with, keeping up with the Kardashian reality show and so much more. She really has propelled that family to fame and fortune. She's recently been back in the news because of her amazing recent transformation. As you can see here, obviously in the past she's had multiple cosmetic procedures, but today when you look at her, she's had a recent uplifting transformation, not only with skincare and potentially neuromodulators, but an incredibly good facelift. And I think that's really what it's all about. And the hype has been, oh, it's a deep plane facelift or not. And I would say, since she revealed that her surgeon was Dr. Steve Levine, who's an excellent plastic surgeon, who's NYU trained. I know him well. He's superb. And I know he doesn't do the deep plane facelift. So, surprise, surprise. But all I can say is that since he doesn't do the deep plane facelift, this is not a deep plane facelift result, because it looks great. In fact, a lot of the recent people that you've seen that have been transformed, not only Kris Jenner, but Demi Moore and Brad Pitt and others, I doubt that any of those had a deep plane. And this certainly was not a deep plane facelift. It was a real facelift, and I think it was a Smas type facelift because it looks natural, looks beautiful. And I think that's a good thing, because she had, her brows are better. She probably had, her upper eyelids done, a lateral brow. I'm almost positive she had a Smas facelift because, she said that Dr. Levine was her facelift surgeon and he does a Smasectomy or a Smas stacking because he was trained by Dr. Dan Baker, who's a world famous plastic surgeon in New York who does the Smas and has really championed that. And she may have also had some great skincare, maybe some peel or laser, and certainly no fat or fillers. And of course, she's had incredible makeup. And she probably also has had a revision of her nose, because that looks better, because it looks more refined. And it's still an early result from both. And of course, everybody looks great the first 6 months. Let's just see what she looks like at a year and a half. But this is definitely a good facelift. And I think, when you look at that, you say, well, that's a wow, and that's a good thing, because there's so much hype out there about the deep plane, how it's transformational, and it's not a new operation at all. It's really not the deep plane, it's more medial dissection of the Smas dissection, and that's really what potentially, releases more ligaments, but does it really give you a better result? You can see this is a Smas facelift. Looks pretty darn good to me. It looks pretty natural. And I think the other thing is it looks natural. And of course, Kris has had a lot of different, she's had previous facelift, Botox fillers, all these things, which she's talked about. But today, she's got a smoother jawline, her shape and neck is great, her elevated brows. And it's really, I think, a beautiful result. And I think kudos to Dr. Levine for doing that, because in the evolution of Kris Jenner's face transformation, you can see she's had, a lot of things that have been enhanced, from good skincare to good makeup to good plastic surgery. And now I think she's had finesse facelift, finesse rhinoplasty, and other ancillary things. So the power of subtle, comprehensive rejuvenation is very important. So choose the right surgeon. Choose a surgeon that understands the art of facial cosmetic surgery and somebody that actually can do it well without making you look unwell. That's so important, because remember, we're in the face protection, not witness protection program. And she looks great. And I think that's the beauty of how this was done. So I would say it looks natural, it looks rejuvenated, and it's pretty spectacular result. What's the cost? It's been rumored to be around $300,000, whatever. But Dr. Levine is an excellent board-certified plastic surgeon, and he really has delivered well on this Smas type facelift to give a natural-looking result, which I think is what everybody wants. They want a natural-looking result. So I would say, remember, you know, the Smas versus the deep plane, they both are excellent procedures. Whether any of these people have had whatever procedure, I would venture to say that some of these people probably, or both of them probably had a Smas facelift, not a deep plane facelift. And especially when you look at the before and afters on Demi Moore, it's been thought that she had a deep plane and then it was fixed with a Smas facelift, you can see. So these are all people, their common byline is that they all look good and they all look natural. They don't look weird, and I think that's the good thing. So to me, Smas is still the gold standard for natural rejuvenation. You know, the deep plane is a subcategory that actually can and should be used in certain types of faces, especially the more significant aging face, and I think in the male facelift, I think it works well. So is one better than the other? Nobody really knows. There's no long-term studies to show that one's better than the other, but you can see in this recent ongoing debate on famous faces, the subtle Smas, with people like Demi Moore and Brad Pitt and now Kris Jenner. I think that natural look without the look of facelift surgery really makes you think twice. And it's really about selecting the right technique for the right face by the right surgeon. That's important, not the other thing. So that should be the take-home message, is that, you know, elegance bespeaks results done by a superb plastic surgeon. And I think surgical planning personalized to the anatomy and aging is really what you want. And you want the best facelift that's the one that fits you. And obviously this facelift that Kris Jenner had, which I conjecture is the Smas facelift, works well and looks beautiful on her. So the appearance and the buzz of the Smas versus the deep plane goes on because we have to decide when we look at a patient, what is the aging process? What does the face look like? What does the neck look like? And then what are the techniques that work well, that are safe, that can give you a beautiful, long-lasting result that's safe. Know before you go. Give me your thoughts, give me your comments on Kris Jenner and all the other types of Hollywood movie stars that have been rejuvenated lately. It's really not a big secret. Now, it's great that Kris Jenner revealed that, but know before you go. Everybody ages differently, but the key is you want to make sure that when you reverse aging with facial rejuvenation, you do it well. Thank you so much. Until next time, please subscribe to Rohrich Knose podcast, and we'll bring you more up to date on this and so many other things that will help you become a better you.